blood patch is a simple yet effective procedure used to treat a specific type of headache known as a post-dural puncture headache. This headache is a potential complication that can occur after a spinal tap or epidural anesthesia, procedures commonly used for pain management during labor and delivery or for certain medical tests. The blood patch involves injecting a small amount of the patient's own blood into the epidural space, the area surrounding the spinal cord. The primary goal of a blood patch is to alleviate the debilitating headaches associated with post-dural puncture headache. These headaches are often described as severe, throbbing, and worse when sitting or standing. They typically occur within 72 hours of the spinal tap or epidural procedure. The blood patch acts as a sealant, plugging the hole in the dura mater, the outermost membrane surrounding the spinal cord and brain. This helps to stop cerebrospinal fluid leakage, which is the underlying cause of the headache. Post-dural puncture headache is a common complication following procedures that involve puncturing the dura mater, the membrane that surrounds the spinal cord and brain. These procedures include spinal taps, also known as lumbar punctures, and epidural anesthesia. The headache usually develops within 72 hours of the procedure and can range from mild to severe. The hallmark symptom of post-dural puncture headache is a headache that worsens when sitting or standing and improves when lying down. This positional characteristic is due to the change in pressure within the cerebrospinal fluid system. Other symptoms that may accompany the headache include nausea, vomiting, dizziness, neck stiffness, and ringing in the ears. The intensity of the headache can significantly impact daily activities, making it difficult to work, care for children, or even perform simple tasks. The effectiveness of a blood patch lies in its ability to address the root cause of post-dural puncture, headache, cerebrospinal fluid leakage. When the dura mater is punctured, cerebrospinal fluid, the fluid that surrounds the brain and spinal cord, can leak out. This leakage reduces the pressure within the cerebrospinal fluid system, causing the brain to sag slightly within the skull. This sagging stretches the sensitive, pain-sensitive structures, leading to the characteristic headache. The injection of blood during a blood patch serves as a mechanical plug, effectively sealing the hole in the dura mater and stopping the cerebrospinal fluid leakage. The injected blood clots at the puncture site, creating a barrier that prevents further fluid loss. This, in turn, restores the normal pressure within the cerebrospinal fluid system, relieving the headache and associated symptoms. Scientific studies have consistently demonstrated the efficacy of blood patches in treating post-dural puncture headache. The blood patch procedure is typically performed by an interventional radiologist, an anesthesiologist, or another qualified healthcare professional. It is a relatively straightforward procedure that usually takes about 30 to 45 minutes. Here's a step-by-step guide to the process. First, patient assessment and consent. Before the procedure, the interventional radiologist will review your medical history, ask about your symptoms, and perform a physical exam. They will explain the procedure, its risks and benefits, and obtain your informed consent. Next, aseptic preparation. The area where the blood patch will be performed, usually the lower back, is thoroughly cleaned and disinfected using an antiseptic solution. This helps to prevent infection. Sterile drapes are then used to create a sterile field around the injection site. Then, local anesthesia administration. A local anesthetic is injected into the skin and tissues overlying the epidural space to numb the area and minimize discomfort during the procedure. Following that, blood withdrawal. A small amount of blood, typically around 10 to 20 milliliters, is drawn from a vein in your arm, just like a regular blood draw. After that, epidural needle insertion. Using sterile technique, a special needle called an epidural needle is carefully inserted into the epidural space, the same space where the original spinal tap or epidural was performed. Next, injection of autologous blood. The withdrawn blood is then slowly injected through the epidural needle into the epidural space. As the blood enters the epidural space, it forms a clot that seals the dural puncture site, stopping the cerebrospinal fluid leak. Finally, post-procedure observation. After the blood patch, you will be monitored for about an hour to check for any immediate complications and to ensure the headache relief. Follow-up care is also important. The interventional radiologist will provide instructions regarding post-procedure care, including pain management, activity restrictions, and when to resume normal activities. Follow-up appointments may be scheduled to monitor your progress and address any concerns. Section 5. Preparing for the procedure, assessment, and consent. Before undergoing a blood patch procedure, you will undergo a thorough assessment by a qualified healthcare professional, often an interventional radiologist. This assessment is crucial to ensure you are a suitable candidate for the procedure and to identify any potential risks or complications. The assessment usually begins with a review of your medical history. The interventional radiologist will inquire about any previous spinal procedures, allergies, bleeding disorders, current medications, and any other relevant health conditions. They will also ask about your symptoms, including the severity, location, and duration of your headache. A physical examination, focusing on your neurological system, will likely be performed to assess your overall health and rule out any other potential causes of your headache. Section 6. Ensuring sterility, aseptic preparation, and anesthesia. Maintaining a sterile environment throughout the blood patch procedure is of paramount importance to minimize the risk of infection. To achieve this, a meticulous aseptic preparation is performed before the procedure begins. The interventional radiologist performing the blood patch will thoroughly clean the skin at the injection site, usually the lower back, using an antiseptic solution. This solution effectively kills bacteria and reduces the microbial count on the skin's surface. Once the skin is disinfected, sterile drapes are carefully placed around the injection site to create a sterile field. These drapes act as a barrier, preventing contaminants from the surrounding environment from reaching the injection site. Section 7. The blood patch process, from withdrawal to injection. With the patient properly prepared and the sterile field established, the blood patch procedure can commence. The first step involves drawing a small amount of blood from the patient, typically from a vein in their arm. This process is similar to a routine blood draw and usually involves taking around 10 to 20 milliliters of blood. An interventional radiology nurse will draw the blood using sterile technique. Once the blood is collected, the interventional radiologist will use a special needle called an epidural needle to access the epidural space. The epidural space is the area surrounding the spinal cord that contains cerebrospinal fluid, or CSF. The needle is carefully inserted, using sterile technique, into the same area where the original spinal tap or epidural was performed. This can also be done under CT scan for a guided procedure with an interventional radiologist. Section 8. Immediate post-procedure care. Following the blood patch procedure, you will be closely monitored for about an hour to assess for any immediate complications and to evaluate the effectiveness of the procedure in relieving your headache. During this observation period, your vital signs, such as blood pressure, heart rate, and respiratory rate, will be regularly checked. The healthcare team will also assess your pain level and monitor for any signs of improvement in your headache. You may be asked to lie flat on your back for a short period after the procedure to help the blood clot properly and minimize the risk of a spinal headache. It's important to inform the medical staff immediately if you experience any new or worsening symptoms, such as severe headache, back pain, numbness or tingling in your legs, or difficulty urinating. Section 9. Benefits and potential risks of a blood patch. A blood patch is a generally safe and effective procedure with a high success rate in treating post-dural puncture headaches, or PDPH. It offers several benefits, including rapid headache relief, reduced need for medication, and faster return to normal activities. One of the primary benefits of a blood patch is its ability to provide quick relief from the often debilitating headaches associated with PDPH. Many patients experience significant pain reduction immediately after the procedure, while others may notice gradual improvement over the next 24 to 48 hours. By effectively sealing the dural puncture site and stopping CSF leakage, the blood patch addresses the root cause of the headache, leading to long-lasting relief. Section 10. Recovery and follow-up. What to expect. After your blood patch procedure, you can expect a relatively quick recovery period. Most patients are able to go home the same day and resume their normal activities within a few days. However, it's essential to follow your healthcare provider's instructions regarding post-procedure care to ensure optimal healing and minimize the risk of complications. In the first 24 hours after the procedure, it's generally recommended to rest and avoid strenuous activities. You can gradually increase your activity level as tolerated, but it's important to listen to your body and avoid anything that causes pain or discomfort. Your interventional radiologist may advise you to avoid lifting heavy objects, bending over frequently, or engaging in activities that put strain on your back.